community association law, family law, bankruptcy law, along with health show topics like pain management, men's health, and dental implants. Now, sit back and enjoy today's Ask the Experts with host Steve-O.
Hey, good evening. Welcome to another Ask the Experts. We are live. This is not a tape show. We're live. We can take calls. Tonight is Thursday night. We're on every Monday and Thursday from 6 to 7. And some of our shows are a little better than other shows. Tonight's show, we probably get more people writing us than any other show. And I know what it is because I just got 4 of the same question this week. But we have, without a doubt, the top urology center, Broward Urology Center. And it's not just in Broward, but of all South Florida. And we have one of the senior partners who's with us every month, Dr. Eric Shenvin. Good evening, Dr. Eric.
Good evening, Stephen. How are you?
Oh, you see, he's asking me how I am. Here's a doctor, a urologist, that had kidney stones. Who?
We're losing your audio.
Oh, no. Can you hear me okay?
Yep, looks like it.
Okay. What I'm wondering is, you go on vacation, you're a urologist, and you get kidney stones?
Well, you're making me look bad here.
No.
The urologist who shouldn't be getting a kidney stone, but it's sort of like I say, we make other lives better while limiting our own or hurting ourselves. But yeah, I got a kidney stone, as you know, last show. A month ago, we were skiing in Colorado, and I think it's really wearing the mask, and I have not been drinking, being a good water drinker like I have been for many years. And it's really, I have to push now. I really have to stop myself from running in the office and really stop and gulp down some water and get back into it again.
Well, I was really trying to prove how normal you are, even though you're a doctor. And I'm also feel bad that on your vacation, of all times, to get kidney stones.
Well, at least it was the end. I got to ski 3 out of 4 days, so it was very nice. It was
That's
great
good.
being there with the family, and still had a really good time.
Well, Dr. Shenvin, you have an incredible office. It's a new office, basically. I know you've been open for a while, but tell everybody about your practice.
So we are urologists in private practice. We practice under the corporate head of Genesis Care USA. We used to be 21st Century Oncology, which was now purchased by Genesis Care USA, which is an enormous cancer medical kind of care company that has come from Australia now into the market in the United States. So it really doesn't factor in as to how I practice on a daily basis. It really actually provides us with many more options, many more outlets, an excellent source for cancer care. But as a urologist, we deal with lots of cancer, but far more than cancer. And I think it just has enabled us to have a little more of a group footprint in today's medical world. We practice in Fort Lauderdale. We're in southeast Fort Lauderdale, just right near Broward Health Medical Center. Down the street happens to be where our new office is, in a thriving new area, which had a new Whole Foods and condo building just up the street from us. And it's myself, and I joined originally 2 other urologists, Dr. Fowler and Dr. Yovel. Dr. Fowler has retired about 8-9 years ago, and Dr. Yovel is our true senior urologist here. He's still practicing, and Dr. Gorbati is our junior partner, and junior partner, not a junior partner. And he has been practicing since 2012 with us, so we have a nice team here.
I got to ask you this question because I'm asked so much. We have a lot of lawyers on here, financial people. You're one of the few doctors on here. The big question is about the vaccination. Should people get the vaccination?
I think if you want to talk on strict medical terms, then the answer is, I think, yes, because it seems that the benefits outweigh the risks. But it's also very personal, and there's a lot of stuff we're not going to know for the longer term. My kids have not been. My kids are healthy and whatnot. My daughter was asymptomatic with COVID positive. Thankfully, was not ill at all, but definitely had uh, the uh, the viral infection without symptoms, thankfully, and my son hasn't had. And the questions come up for the kids: could there be longstanding infertility issues,
Oh, yeah.
and just many things for the kids that we just don't know. That's kind of scary, I have to admit. But for, I think, certainly everyone over the age of 60, 65, I think the benefits outweigh the risks. And yeah, there may be some longer term risks that we just don't know because who knows what, but there's not a lot of people, it's not a large actual percentage of patients who are healthy, even older, who are dying, but there are plenty of people who get very ill and have some long lasting effects: shortness of breath, the taste, the smell, just the fatigue. And so, really has to be a decision for you. But I think on a general medical statement, I think I'm for it.
Okay. Oh, that's a good answer. Tonight we're going to be talking about enlarged prostate and some of the signs and symptoms, and about getting it diagnosed. When should a person come in to your office to be tested for prostate cancer?
So for prostate cancer, I thought you were going on the BPH side, the enlarged prostate. But for prostate cancer, generally speaking, and we as urologists, American Urology Association, American Cancer Society, have maintained the opinion and the stance that after the age of 50, and sometimes if there's a family history, certainly in more than one family member, a close family member, father, uncle, brother, grandfather, or in black gentlemen with a family history, or even some black gentlemen at age 45, we might start screening. But those are the kind of the ages that we look to bring men in to start with a PSA blood test and a rectal prostate exam. It takes about 2 seconds. And really, it's both of those that we are really insistent on getting because you can miss with one or the other. So it's
So,
really
and
that
then
age. So
what about the enlarged prostate?
I think we never know. Things don't come with a label on the diagnosis. And I think at any age, if someone is having a change in their urinary habits, and most of us should be able to sleep the night through, we always used to, and there's many reasons why people might get up at night, but also a weak stream. Certainly, if you start seeing blood in the urine or going more frequently or urgently, certainly if you're having incontinence, urine leakage, those are all reasons to come in and see a urologist and be evaluated, man or woman. I know we're talking about men tonight, but I think it's the symptoms that drive men in, and it's not an age. Generally speaking, 50, 55 and up is when guys start to see the prostate getting bigger and starting to have some effects on their urinating. But we do see it in men younger, 45, 50 years old as well, sometimes less commonly.
I just got a text from a listener, and I know we've been asked this before, but I'm going to do it again for the listener. They want to know what the difference is in a urologist and a nephrologist.
A urologist is a surgeon, a nephrologist is not. So we both share the kidneys, if you will. Nephrologist is much more specific to the kidneys themselves, their function, and then, of course, when they're not working, starting a patient and running dialysis for kidneys that don't work, and eventually helping some of them to help manage transplant patients if they end up getting a kidney back. And any of the diseases, the medical diseases that might be treated medically of the kidneys. Urologists are surgeons, surgical subspecialists for the genitourinary tract. So anything from the top to the bottom, from the kidneys all the way down to the urethra, the bladder, the urethra, and so on, is all our fair game territory. Whether there's a tumor in the kidney, a stone in the kidney, a stone passing, a stone in the bladder, tumors in the bladder, enlarged prostate, urinary issues, that's where we come in.
You know, I got to tell you, the people are listening now. I'm going to ask you a question because, you know, people let it go. They don't go in to make sure they're healthy. And tell us some of the things, the downside, if you don't take care of, for example, an enlarged prostate.
So sort of the repercussions as it gets longer standing as the prostate gets larger and blocks the outflow, because it wraps around the urethra. It's right next to the bladder. The urethra runs through the center of it. You can think about an orange with that core, or like an apple, like the core running through, but it's hollow, sort of like a long donut. So as the prostate gets bigger, it grows out, and maybe we feel it getting bigger on an exam, but it also grows in and starts to squeeze down the channel, that hollow core, and that's what causes the urinary problems. And over time, as the bladder starts to fight it, a man may start to retain urine, which can result in infections. It can result in stones in the bladder, different than kidney stones, just more from urine sitting around. And the backup of urine into the bladder can eventually back up into the kidneys if it's bad enough and put pressure on the kidneys and then cause harm to the kidneys. And eventually to the point where a man may not be able to urinate at all. We see them in the office. The emergency room has to have a catheter put in, and can certainly even lead to kidney failure, whether it's acute or even longer standing. So those are all the things. And this day and age, I think there's so much out there, and you can see so much of it online. We've got great new treatments in the office, plenty of treatments in the hospital, but there's a lot of stuff we have in the office in our arsenal that really makes it a lot easier on men. And even if a man has debilitating illnesses, heart and lung, that prohibit him from going under anesthesia in the operating room, some of these office procedures really have come of age.
Well, before we go to break, I just got another question. I hope this isn't a strange question. They want to know what causes urine to have a foul odor to it.
So the concerning thing is bacteria, which can be from an infection or what we call colonization, where the bacteria just kind of living there, not really overstaying their welcome, causing any problems. But as much more common in women, does happen in men, as you get older, over the ages of 70 and 80 and up, it's very common for them to become colonized with bacteria, which the bacteria themselves can sort of cause that smell. That said, you know, patients who don't drink enough fluid have more concentrated urine, which is going to have a stronger smell. And certain foods, the classic one everyone knows is asparagus, that most people have that smelly urine when they eat asparagus. But there's other foods also, and usually vegetables, in that same kind of cruciferous class, broccoli, cauliflower, beets, that can have some effects on the urine and can affect the smell.
Wow. Eric, give everybody the phone number at the center.
Our phone number here at Broward Urology Center is 954-463-6408. You can find us on the web at browardurologycenter.com. Find us on Facebook as well.
We're going to go to break, and when we come back, we have more with Dr. Eric Shenvin of the Broward Urology Center. We'll be right back.
Are you suffering from erectile dysfunction, also known as ED? The urologist at Broward Urology Center can help men regain their sexual health in a comfortable, discreet environment. ED can result from age, low testosterone, high blood pressure, diabetes, smoking, sleep apnea, high cholesterol, and cardiovascular disease. When a man is first seen in the office at Broward Urology Center, a thorough evaluation is done by the doctor, which begins with an open, honest, and absolutely confidential discussion about their overall medical health and current sexual function. A complete physical exam is performed, and blood work is often ordered. Once a full workup is completed, a customized treatment plan is designed for each individual patient. They offer all treatments for ED, including the newest shockwave therapy and the P-Shot. Contact the Broward Urology Center today to discuss all the different options they offer for ED at 954-463-6408.
And we're back. We're here with Dr. Eric Shenvin of the Broward Urology Center. And we have to discuss what's happened is we get all these people that don't want to call in. They just want to text in. I want to get their questions answered, but it doesn't leave us a lot of time for the questions that we have. But I know you wanted to discuss tonight about the UroLift and the procedures.
So those are, as I alluded to, some great newer, I'll say new, they're not brand new, but newer procedures in the last few years that we're doing in the office for enlarged prostate. And the UroLift procedure is a very simple way to explain this procedure. And it's not for gigantic prostates and guys with really big problems and guys that come in with really bad retention, but more common, more run-of-the-mill enlarging prostate with progressively worsening urinating problems where either they have problems with the medications, side effects, cost, just tired, they take 16 other pills, don't want any more, so want other options, or it's just the medication never worked well enough or no longer work well enough. So these procedures such as the UroLift is a procedure that can be done in the office. It can also be done in the hospital under anesthesia, but these days we can even do it in the office.
Outpatient.
And there is a small scope-like device that goes into the urethra, and this is done in the office under local anesthesia. You can also do it with the addition of nitrous oxide. So I just did a couple of Resume cases, which we can talk about in a sec, under nitrous oxide today, where the patient's not really sedate, they're really holding the mouthpiece themselves, but it really is providing analgesia, not anesthesia, meaning it's helping with any kind of discomfort, and they really soared through the cases today really nicely. So the UroLift is, everyone knows that when we buy like a 3-pack of socks, it comes with that little tab at the top that squeezes the socks together, and it has like a piece vertically with a connecting thing in between. And that's really exactly how I describe the UroLift. Now what it is there's a skinny scope that we use that deploys that string, if you will, that has a metal tip at the end that goes through the prostate from the inside, releases on the outside of the prostate a tab, and then on the inside, once we get to a point, it compresses the gland of the prostate. And then it fires the end piece so that you now have that sort of sock-like tag, that almost an H, looks like an H with the string in between. And what it's doing is, if you can picture from the inside where my thumbs are here and the inside of my hands holding, being the inside of the prostate, the channel running down from my thumbs is, we're compressing a lobe and compressing a lobe, and you can see that the channel opens up. Wow. Initially, I was very skeptical about this, thinking stones would grow on these little pieces and have problems. But that really hasn't happened, thank goodness. And it turns out for the right patient that you evaluate for, this can be a great, quick procedure, and these things can take 5 minutes.
I was going to ask you how long the procedure is and who would qualify for something like this.
the prep time, honestly, or the amount of time we're doing this and doing that and getting them ready, and if we're using the nitrous or we're doing a prostate block, the prep time could be 15, 20 minutes. The procedure time is like 5,
Wow.
maybe even less. And it's the patients who have a prostate, we say smaller than 80 grams, and I don't expect anyone to know what that
Right.
means, but that's sort of a moderately enlarged prostate, not a gigantically enlarged prostate. And again, guys come in sometimes thinking, oh, I have an enlarged prostate. I need that UroLift procedure. I need that Resume procedure. And you end up looking in as a part of the evaluation with a small diagnostic camera, and you see that the prostate is not enlarged in and of itself, that there may be more bladder issues and so on. So again, everyone is not a candidate. And it's even sometimes hard for me to try and figure out and decide this UroLift procedure, maybe a Resume procedure. Who's going
Right.
to be a better candidate? And sometimes it's the shape of the prostate, if they have a large central component to the prostate, and those might be people I lean more on the Resume procedure than the UroLift. And I'll tell you, as a clinician, sometimes our perspective changes as we do more and see how more patients do.
Is there much discomfort?
There really isn't. And we're able, again, I think I kind of like it to maybe a dentist filling a cavity.
Oh, okay.
I think without that small injection, that numbing stuff or some laughing gas, which is the nitrous, okay, that some dentists will do it without the numbing injection, just on nitrous, because it does provide analgesia, pain relief, without making you really knocked out. Maybe a little tiny tipsy, like a couple of martinis, we say.
You can go to
but not
work
like
the
6
next
of them.
day. You can go to work.
I'm not comfortable. I always make patients have a ride home. But from the company, they're very comfortable after 15 minutes having the patient drive themselves home, just to give you an idea. But
Okay.
I don't think that's worth the risk right now. And simple procedure.
So, how long has this procedure been out for?
Well, I want to say probably 5+ years really mainstream.
Okay,
We were
so-
seeing a lot of research articles on it for quite some time. Dr. Klaus Roburn, he does a lot of the enlarged prostate research stuff. And that's the UroLift. The Resume is a little different kind of procedure, just so since we mentioned it, people can hear it, where we're poking a probe. Again, we're going in through the urethra, but we're poking a probe into the tissue, and it delivers steam, and the steam heats up the tissue. So what happens is I get people to think about what happens when a grape sits in the sun. It eventually shrivels up and becomes a raisin. So if that grape then we think about is a donut, and a long donut, when we poke into the donut cake and heat it up, as the donut circumferentially shrivels up, the channel then will open up. Now that is not as immediate as the UroLift, but again, there's pluses and minuses to each, pros and cons to each, and sometimes it's dealer's choice, where a patient could be a candidate for both. But I've seen amazing results with the Resume in as quick as a few weeks. And it really kind of blown my mind with that procedure, which I would expect to take a couple of months, more like the traditional microwaves and needle ablations and lasers that we've done similar to it, other means that heat up the tissue. The Resume works faster than anything I've ever seen, to the point where it kind of defies physiologic understanding.
And so you've got so many things in your little bag, so to say, when it comes
It's
time
nice to have options. It's
Yeah.
not always easy to make an option or a choice. And there are certainly the green light laser and the classic traditional roto-rooter job that we've been doing for years in the OR that works great. You got to cue your patient, because some patients, you go to touch them on an exam and they start jumping off the table. That's not the guy, maybe with some nitrous, but probably not the guy that you really want to do in the office.
Right. And again, you do this right in your office.
Absolutely.
Okay. I really wanted to get in tonight to prostate cancer. You hear so much about it, but we had 3 or 4 people who text in. I'd like to get to their calls, even if it's not necessarily on subject. But I promise you next month, and I know I will remember this, that we will devote a good portion of the show to prostate cancer, because there's so many, I guess, different advanced things out there for prostate cancer.
For sure. We have, with the radiation, I'm now doing the SpaceOAR procedure in the office where, again, done under local. I taught myself kind of how to really do it carefully in the operating room, and now do it under local in the office, completely under local. It takes about 15 minutes to do. And it's introducing a gel in between the rectum and the prostate to protect the rectum during some traditional and even newer higher dose radiation type of procedures they're doing. We've got robotic surgery. Dr. Borbati in my office does all our robotic prostatectomies, doing a kidney surgery right now. So there's a lot of super cool high-tech stuff out there, and for better or for worse for us to learn, more and more coming all the time.
So now prostate cancer is, like it used to be a long time ago, almost a death certificate.
No, not at all. Not at all. I think that, again, as long as it's diagnosed early, and I will tell you for the late stage patients, which we're not going to get into here, but every 6 months there's another type of hormone, chemo kind of pill, oral medication that comes out, another IV kind of medication. It is very difficult to keep up with advanced prostate cancer. There are so many more treatments out there to keep it at bay and prolong a man's life in a much better way than used to be.
Well, we've been talking here with Dr. Eric Shenvin. He's a urologist, has the most beautiful center, Broward Urology Center. He's with us every month. Give everybody your phone number, Eric.
Our phone number here at Broward Urology Center is 954-463-6408.
And like I said, Eric will be back with us again next month. We're going to go to break. And when we come back, we have our family law show. We'll be right back.
Good to speak.
Are you suffering from erectile dysfunction, also known as ED? The urologist at Broward Urology Center can help men regain their sexual health in a comfortable, discreet environment. ED can result from age, low testosterone, high blood pressure, diabetes, smoking, sleep apnea, high cholesterol, and cardiovascular disease. When a man is first seen in the office at Broward Urology Center, a thorough evaluation is done by the doctor, which begins with an open, honest, and absolutely confidential discussion about their overall medical health and current sexual function. A complete physical exam is performed, and blood work is often ordered. Once a full workup is completed, a customized treatment plan is designed for each individual patient. They offer all treatments for ED, including the newest shockwave therapy and the P-Shot. Contact the Broward Urology Center today to discuss all the different options they offer for ED at 954-463